Greetings, listeners and learners. Welcome to our 6th episode of Healthcare Headlines, a podcast summarizing the recent major healthcare news and what you need to know. Now that our next president has been elected and a Republican Senate and House confirmed, in this special episode, we look at President Trump's and the Republican stances on key healthcare policies that matter to health systems, hospitals, and providers. I'm Dan Grauman, Managing Director and CEO of Veralon, a management consulting firm that helps clients with their most challenging issues in strategy, finance, M&A, physician alignment, and compensation. We also offer our virtual board education solution, which is a tech-enabled, video-based governance education service for board trustees. This podcast will live on our virtual board education platform and wherever you get your podcast. So, let's jump right in to our top healthcare policy takeaways. First up, let's talk about the Affordable Care Act, or the ACA. During his first term, Trump attempted to repeal the ACA and encourage the sale of lightly regulated insurance plans that would cost less and cover fewer health conditions. Trump also encouraged reduced advertising for the ACA plan enrollment. During the campaign, he expressed interest in replacing the ACA, but has not enumerated a specific plan for doing so. Following the election, companies with business from ACA marketplaces saw their stock go down. During Trump's first term, congressional Republicans attempted and failed to repeal the ACA. With a Republican Congress during his second term, Trump may continue his efforts to repeal the ACA. However, at this point, it is unclear what actions he will pursue. More to come on this in future episodes. Next, with respect to Medicare, Trump has pledged not to reduce Medicare funding and aims to strengthen it for future generations to ensure its solvency. While congressional Republicans are actively promoting Medicare Advantage, Trump's position is unclear. In the wake of the election, businesses operating in the Medicare Advantage space are expected to increase performance as Republicans are pushing the growth of this market. Stock prices of insurers that have significant presence in the Medicare Advantage plan space, including United Health Group, Humana, and CVS, have all risen. Now, let's touch upon Medicaid. Trump's past actions suggest he may restrict Medicaid eligibility and funding during a second term. In his first term, Trump's administration pushed for Medicaid work requirements and attempted to reduce Medicaid spending through block grants. In fact, a ballot initiative this election cycle to encourage the imposition of work requirements for Medicaid eligibility passed in South Dakota. Meanwhile, companies involved in Medicaid services saw their stock prices go down, reflecting concerns of Medicaid's financial outlook under a Republican president. A Republican president and United Republican Congress are likely to push for greater state control over Medicaid programs. This could include expanding the use of Section 1115 waivers, which gives states more flexibility in how they run Medicaid. Under Trump's first term, these waivers were used to implement stricter eligibility rules such as work requirements. They also opened the door for states to try cost-saving measures such as managed care programs, which aim to improve patient care while cutting costs. Individual states administer Medicaid and choose whether to receive block grants. So it is important to track your state government's Medicaid policies and legislative changes. Next, let's touch on M&A and healthcare consolidation. President-elect Donald Trump was opposed to regulation during his campaign. His administration permitted one of the largest healthcare mergers in U.S. history between CVS Health and Aetna. Meanwhile, congressional Republicans have recently voiced interest in crackdowns on healthcare consolidation and vertical integration, particularly in light of the cyber attack on Change Healthcare. Under a Republican president, the FTC, or the Federal Trade Commission, may take a more lenient stance on antitrust enforcement. This could make it more likely for stalled mergers to get a second look and potentially move forward. Next up, let's touch on rural health care. Trump's first term and policy stances during the campaign suggest this administration will work to improve rural health care. During his first term, Trump signed an executive order to improve rural health and telehealth access, which provided for investments in healthcare infrastructure, launching an innovative payment model, and expansion of telehealth services. The Vice President-elect, J.D. Vance, emphasized rural health during the campaign. Next, let's discuss the role the Republican immigration policy will have on healthcare access. For undocumented immigrants seeking healthcare, a trusted relationship with a healthcare provider or organization is crucial. Trump and congressional Republicans have discussed cracking down on undocumented immigrants. It is possible that during this next political period, undocumented immigrants may be more cautious about showing up at hospitals, health systems, and health centers to receive care, which may impact hospital volume in certain communities. Moving on to the topic of prescription drug pricing. Trump is likely to continue efforts to reduce drug prices, building the focus of reducing out-of-pocket prescription drug costs during his first term. It is uncertain if Trump's most favored nation policy put forward in his first term would regain focus, whereby drug makers would be required to sell drugs to Medicare at rates paid by other nations. A previous special assistant for Trump, Theo Merkel, said, quote, "The number one issue he cared about while I was in the White House, and I continue to hear him talk about, is lowering drug prices. I'm confident that will be at the top of the agenda," unquote. Meanwhile, high-ranking Republicans have recently indicated a desire to repeal the Inflation Reduction Act's Medicare drug price negotiations. The Inflation Reduction Act requires Medicare price negotiation for certain drugs. Next up, let's talk about agency appointments. Trump has nominated Robert F. Kennedy Jr. to be Secretary of the U.S. Department of Health and Human Services, or HHS, with an agenda for making America healthy. HHS is the federal department that oversees several health agencies, including CMS, the FDA, and the NIH. This appointment requires Senate approval. Of course, RFK Jr., Bobby Kennedy's son, and a former independent presidential candidate, has expressed interest in reducing corporate influence on government agencies, banning pharmaceutical advertising, and launching initiatives targeting obesity and diabetes in children. While he has expressed plans to overhaul the FDA, RFK Jr. has not specifically commented on plans for CMS. Now, let's discuss another Trump appointee to a healthcare post. Dr. Mehmet Oz has been appointed by Trump to be administrator of CMS. This is another nomination that requires Senate confirmation. Dr. Oz, a former TV personality and cardiac surgeon, ran for a Senate seat in Pennsylvania in 2022 as a Republican candidate. Dr. Oz's plans for CMS are not currently public, so stay tuned for more news on this in the coming weeks. So to wrap things up, in conclusion, overall, we can expect the Trump presidency and Republican Congress to likely focus on reducing healthcare costs through continued efforts to lower drug prices, weaken the Affordable Care Act, limit Medicaid eligibility, and promote rural health care. Healthcare consolidation and Medicare policy under Trump remain uncertain. Finally, it's important to remember that while federal policy is important to track, Much of high-impact healthcare policy occurs at the state level. It is essential to keep an eye on your state to understand how your state government will impact health policy. So this covers the healthcare policies we can expect from a Trump presidency and a Republican Congress as of November 22nd. As the dust continues to settle on the composition of Trump's administration and key Republican policy stances, stay tuned to Healthcare Headlines for more announcements. The one constant we can count on in healthcare is change. So tune in next month for new developments in episode 7 of Healthcare Headlines.